Oh no 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 no.
When I first saw the application for it, I mean, it had everything that I loved, and it was basically like being able to sort of make my dreams come true in a way. It allows you to travel, it allows you to experience things outside of medicine, it allows you to see all aspects of medicine, and it's just such a fantastic program. Can't say enough about it.
My parents are farmers. I mean, they've never been to a different country, and it allowed me to go up north, work in like the inner city, and travel to Africa. And I mean, lots of people just don't get those opportunities, and what a great thing to be able to, one, get into medical school and then be provided with this opportunity.
Making the links is a project that I would say emerged out of our original work with the Switch Clinic, the Student Wellness Initiative towards Community Health. Several of the individuals, including Dr. Miley and Dr. McGonigal, who were interested in the original development of the Switch Clinic, wanted to expand the opportunities for experiential or service-based learning. So making the links comes out of that and includes elements of international work in third world countries and also with communities of need in the north of Saskatchewan.
The Making the Links program started in 2005, and Making the Links consists of three main parts. There's the Northern Experience, Switch, and Mozambique. And through that, through the students spending time in different populations, a rural, remote, largely Aboriginal population, in an inner city community, and also in the developing world, they get to see health issues in three different contexts that have similarities and differences, but all of which have a degree of being marginalized or underserved.
Top priority, peace before everything, God before anything, love before anything, real before everything, home before any place, shoot before anything, style and stay radiate, love power, slay the hate, truth killer, fake face.
Switch is the Student Wellness Initiative toward Community Health, and Switch is a student-run interdisciplinary clinic located in Saskatoon's core neighborhoods. It's located on 20th Street at the Westside Community Clinic across from White Buffalo. And what happens there, you have students from medicine, nursing, pharmacy, nutrition, kinesiology, clinical psychology, social work, etc., etc. I think we have 9 or 10 disciplines that are represented there. And they offer after-hours services to a high-needs community.
We want to teach the future healthcare professionals, teach us students that this community does exist, that this community deserves our respect, that this community has unique needs that aren't necessarily being addressed in other parts of the healthcare system, and to teach us those skills to work with this unique community and to have the interest and the passion to do so.
We're fortunate enough at the U of S to have a fair amount of clinical experience, but often they can be volunteer patients or people that you see for 20 minutes and then you never see them again. But I've volunteered at Switch quite a bit through Making the Links, and I've seen the same people come back again and again, and I'm like, oh hey, how's it going? How's your son's cold or whatever? And so we're lucky enough, even at a medical student level, to get some continuity of care, which is for me one of the highlights of medicine.
The interaction with patients may be one of the most important components of being involved with Switch. You learn clinical skills here, yes, but it's really about the interaction, the bedside manner that makes Switch unique. The population that we're working with here, the community involved is very different than what we see at the hospitals that we're usually working with.
What brings you in tonight?
Going to a little fight down at Joliet High School tonight.
Okay.
Gonna go play some basketball with my cousin and these two boys came out of the vehicle holding a crowbar in their hand, and one of them asked my name. I wouldn't say my name, so it would hit me in the stomach. So I start running from them so anything else happens. And that's what brings me here tonight.
Is it hurt over here? No.
Right here.
They work in teams to see patients and try and help address the problems they're facing from a holistic point of view. So you might have a medical student working with a social work student, working with a PT student.
I really enjoyed working with other disciplines during making the links. I spent a lot of time asking them questions because they know so much about what they do, and it's an area that we don't know that much about. So I really enjoyed actually coming together and sharing knowledge rather than trying to figure it out on our own.
Yeah, I'll definitely want to work in a team atmosphere. It's so much easier than trying to do everything yourself. And when there's easy communication between team members, that's something I'll look for in wherever I want to practice.
We're trying to think in a specific and certain way, and other disciplines have totally different ways of approaching it. And it's really, really good to get that outside feedback. And there's so much that all the disciplines can offer. And it's really important to provide good healthcare and to the range of healthcare to our patients. Our responsibility is to the patients, so we need to offer them as much as we can.
I just can't stress enough how Switch complements one's education no matter what discipline they're from, and I know I'm a better clinician because of Switch and because of the experiences I've had here.
So the students see patients, and then they're supervised by a family doctor and mentors from social work, physiotherapy, nursing, etc., etc. That's part of what happens at Switch. The other part, which perhaps is more exciting from an upstream point of view, is the programming that goes on. There's a lot of education around diet. There's ongoing food, fitness, fun program that combines exercise and education about healthy eating to help people address diabetes, either its prevention or its treatment. There's occasionally yoga classes or craft classes or other ways in which the students put on programming that draws people in and gives them an opportunity to engage and interact with members of a community that they might not otherwise know.
Coming to Switch, we see the population, we work with people who are right next door to us practically, and get to see a different side of town and a different aspect.
These are people that face the same problems in Mozambique as a developing country as they do here. Poverty, lack of services, barriers to existing services. I think they face some of the same barriers here in the north and in Mozambique. You know, you'd like to think that the people that provide your health are people first, and I think probably for me more than anything, what these opportunities provide them is a way to really enhance their peopleness. In a way, not necessarily just to hone their clinical skills or their doctor skills, but to gain experience with the people who need the help the most.
Everybody, I think, believes that if we're ever going to achieve that social accountability, that we have to put our students in those environments where they can experience both the community in which the need exists and the health care provision that is there.
In all the places that we went, things like accessing food, you see how hard that is for some people. Even though someone might live in Saskatoon, they still aren't able to get to a place where they can buy good food or access recreation or things like that. Same thing in the north. The food that you get is terrible. In Mozambique, sometimes there's food around, but if you can't afford it, or if you have to sell it to feed your family, then it's not accessible. And things like recreation just don't really exist for someone who needs to spend all of their time feeding their family. So you do see how that impacts health. You see how poverty impacts health, that people who don't have any money can't buy good food, they can't get a good education. Definitely post-secondary education is out for a lot of people who can't afford it, who have to work or raise kids and aren't able to make really good choices for themselves or are forced into doing things that make them unhealthy.